Hello everyone. Today we shall have a session, a quick one on one of the causes of hair loss. Remember, I said that we have different videos covering different sections that are attributed to hair loss. So in this particular one, we shall look at telogen, effluvium, as one of the causes of hair loss. And it is actually one of the distressing conditions. And oftentimes women will complain to you that every time I comb my hair, I get actually a lot of hair stuck on the comb, and this is actually worrying to them because they are losing hair. But you, as the person examining this patient, you realize that when you examine actually the scalp, in your naked eyes, it may look very, very normal. So this is one of the conditions that we can look at today, and then we see how to deal with it in case you get a patient presenting with this condition. So as you can see in this picture, we see that in this particular patient, the first picture that we see here, there's a significant loss of hair at the crown of the scalp. We see there that there is a lot of hair that is lost, evidenced by the reduction in the density. And you have to tell a difference between this from the one that you've looked at before in the previous video, the one we call the male pattern, the female pattern androgenic hair loss. And then in this second picture, we see that a woman demonstrating for a comb, having a lot of her hairs on the comb. And then this is the histology that we shall explain in a minute. So telogen effluvium is actually defined as increased shedding of otherwise normal telogen hairs, and this can be a response to either pathologic or actually normal physiological change in a healthy individual. So what you have to know is that there are also some chronic forms that are associated with no particular or identifiable trigger that can be seen in some women. And laboratory evaluation is usually directed to if you must take your good history of physical examination, and then you can also examine the scalp for hair loss using either trichoscopy, and you see, or you can take off a biopsy, and then you see if there's any disorder that you can pick out. But you can also use other bedside investigation, the ones that we covered previously, where you can do the tag test, where you can do the hair pulling test, and then you see whether there's a significant hair loss. So in this case, when you look at telogen effluvium, well, you have to assess to and understand how the common scalp looks like. So the normal scalp will have about 10,000 hair follicles, and most of them, that is up to 90%, are usually in the anagen phase, which we call the growth phase. And the growth phase is varied. For some people, it can be even up to years, the hair is still undergoing growth. For others, it can be a little bit shorter, and each individual hair will have its own lifespan. So that is a varied growth phase for the different hairs. And then we know that 10% of the hairs on the scalp are usually in the telogen phase that we call the resting phase. And this can last about 3 months. And normally, yeah, any normal individual can also shed hairs about 50 to 200 hairs per day. And this is done through a process we call exogen, where you now allow hair to fall off, the body allows the hairs to fall off in the normal process. Then we have a catagen phase, and in this phase, it's just a transitional phase from anagen to telogen. So in catagen, it will have about 500 to 1,000 hair follicles in any one given time. And then you have the hair growth cycle, where you have the anagen phase lasting months to years. And then depending on the scalp that you're looking at, you may find that each individual has different durations of their anagen phase depending on your race and your genetics. So there's what we call asynchronous shading. This one usually occurs when you're transiting from one type of hair to the other. So these hairs, when they're getting lost, it is not that maybe the frontal part loses hair, then followed by the other. No. Each hair individual does it separated. That means that you will lose hair in random places on the scalp without it having to go at once. Then the synchronous hair shedding, we usually see it when you're transitioning from the childhood after birth. That is when you're losing the lanugo hairs. That's when you have that uniform hair shedding. And then after that, the hairs stop shedding at the same time. So each individual hair will shed at its own particular time. So you have factors that can affect the hair cycle. This can include metabolic changes, Things like pregnancy, malnutrition, and stress play a key role in determining how you lose your hair. So this can usually cause a shift from anagen phase to telogen phase, and this can give you the telogen effluvium, which is a generalized type of hair loss that can occur at the scalp, occurring almost at once. And you'll find that because this process of the hair spends about 3 months in telogen phase, the inciting factor may have occurred 3 months ago before someone actually manifests with this type of hair loss. So the common causes, we have things that have been implicated, including medications. Remember, we have drugs that can affect hair growth. We have chemotherapeutic agents, which we use to treat cancer, the cancer drugs. Usually, those ones affect anagen. And then these other drugs that affect hair loss usually affect hairs in telogen phase. We also have systemic diseases that can also give you hair loss, like the cancers, all the things that can alter the metabolic processes in the body. Then things like altered physiological states like pregnancy and other things like stress and depression can also result into hair loss. And even major life events like loss of a loved one, loss of a job, and things like that can also affect you, and then you end up losing hair. But we've seen some particular aspect which we call the chronic telogen effluvium, commonly seen in women aged between 30 and 60 years of age. And in this case, barely do we actually identify any particular trigger. So in this particular age group or in this particular women, they end up actually losing hair, but you are not able to identify the particular trigger that is causing them to lose hair in the telogen phase. And when you look at the telogen effluvium, the chronic telogen effluvium has been linked to a reduced variance in the anagen duration of the individual hair. In that case, it will give you a shortened anagen phase. So this is what you're talking about. You will find that the hairs that you have on your scalp, the 100,000 hairs, each hair has its own life cycle and its own time and duration. So you'll find that one hair maybe the hair can grow up to 30 years, it is still growing. Another one takes 20 years, another one 10 years, another one 5, another one 3, another one is maybe at 2. So in this chronic telogen effluvium, you'll find that that variation between the shortest anagen to the longest anagen becomes a little bit short, meaning that more hairs tend to enter telogen phase faster than in the normal scalp. So what is key here in telogen effluvium, there is usually no clinical or even histological evidence of any inflammation, and that is usually what we call the pure telogen effluvium. When you take off a biopsy and examine the scalp, there will be no any inflammatory processes, no lymphocytic infiltrate, no neutrophilic infiltrate. It will be actually normal scalp, but we just reduce ratios between the telogen hairs and the anagen hairs, meaning that you have more of the telogen hairs as compared to the normal scalp. So drugs that have been linked to this type of hair loss include retinoid, especially isotretinoin that we usually use to treat acne vulgaris. That is one of the drugs that you give, but after that, you have to follow up your patients and ask if they're actually having challenges of hair loss as well as psychosis that has been reported with isotretinoin. Other drugs like anticonvulsants, especially the carbamazepine group and phenytoin has also been associated with hair loss. So patients who are on psychiatric medication, they tend actually to lose a lot of hair because of the drugs that they are taking. Other medications like the anti-thyroid medications, the anticoagulants like the warfarin and heparin and warfarin, they can also cause hair loss as well as other drugs like lithium. Lithium is usually used to treat also psychotic condition, and then other drugs like the interferons can also cause hair loss in this phase. So when you look at this table, it tries to show us the normal or the common causes of telogen effluvium, and the common one is usually physiologic, which we usually see in the newborns that we have normal shedding of hair in the newborns. And then we also have another physiological one, which usually occur postpartum. Oftentimes, women after giving birth, they usually lose a lot of hair and they can come in complaining because of the hair loss. But now you have to explain, in this case, the cause is physiological and there's nothing to worry about. Then chronic telogen effluvium has no particular attributable cause, and there's no underlying illness, and it is usually a diagnosis of exclusion after making sure that you have not been able to make any other contributing factor or to make any diagnosis that can explain the prevailing condition. Then we can also have postfebrile telogen effluvium, which occurs after very, very high grade fevers, and this is usually seen in debilitating conditions like severe malaria anemia. With anemia, we can see it in those conditions that like septicemia, which requires you to admit a patient and the rest. And in that case, the patient can also end up losing hair after the condition has resolved. Then even in severe infection, severe chronic illnesses like HIV, systemic lupus erythematosus, even severe prolonged psychological stress, we've seen that already. Post-surgical hair loss can also occur, and then in cases like hypothyroidism, we can also get each occurring in the drugs that we've already mentioned, and this is just a list to highlight them, including heavy metals and then also beta blockers like the propranolol. So in the clinical picture for telogen effluvium, you'll find that you'll have it involves the entire scalp, and I remember I told you that it is one of the conditions that can cause diffuse hair loss on the scalp, and in case it can also affect the scalp as well as the other hair covered areas, the beard area, the pubis area, even the axilla. And when you do the pull test, when you try to pull out the hairs, it will be positive. In this case, you'll have more than normal telogen hairs in that sample that you pull out. And then when you do a trichogram, you get a mixture of anagen and telogen hairs. And in this case, the telogen hairs will be more than 20%. And in that case, that will be actually diagnostic for telogen effluvium, meaning that, when you pull out the hairs, you have to look at the tip. So if the tip is round, for example, if I may draw for you here, if you pull out the hair, usually the tip is round like that, usually that is hair is in telogen. But then if you pull out the hair and then the tip is a little bit bent and curved like that, that shows that that hair is in anagen. So after that pull test, you find that most of the hair, more than 20%, being in this telogen phase, and that will be positive. That will be positive, and it will indicate telogen effluvium. So when you do other investigations that can use is what we call a visual scale. In this case, you can actually tell a patient to examine the quantity of hair that they have lost, depending on the visual scale that you give. And in this visual scale, as you can see here, depending on the amount of hairs, a patient can now compare after combing the hair with a brush or with a comb. Then they compare with how much they have been able to retain on the comb. So if it looks like that, that is estimated to be about 10 hairs. If it looks like this is 200, it looks like this is 50, this is 400, this is 100, this is 750. So that is just an estimate of how many hairs someone has lost using just a visual shading scale. And then when you look at telogen effluvium, it has a good prognosis in case you are able to identify the cause. When you treat, the hair goes back to normal, and doesn't necessarily mean that someone will end up with baldness. And if it is triggered by drugs and stop the medicine, the condition will disappear. So when you're doing evaluation, in this case, you need to do some blood workup, make sure that you understand what is going on in the systems. So that can include a thyroid assessment. You do a thyroid function test. You can do a chemistry panel, including liver and renal function. Then you do a erythrocyte sedimentation rate, the ESR. Then you do a full blood count, where you're able to tell hematocrit to see if there's any anemia, and then you also do ferritin levels, and this should be above 40 nanograms for you to say that someone is optimally okay or healthy. And if you do trichoscopy, surprisingly, the hair shaft will be equal, like everything will look normal on trichoscopy, because remember, the hairs you're losing are already terminal hairs, they're already matured, and we just see, since it is not like a patchy area that you see that in this area the hair density has reduced. When you do a trichoscopy, actually it may be misleading because everything may appear normal. And when you take off histology, still you have normal number of hairs, or as well as normal number of terminal hairs. but what will increase is the amount of hairs in telogen phase compared to what is expected. So this increase can be above 20%, but when you get it as well as 15%, that can be suggestive, but 20% and more is diagnostic. And you find that in severe cases, it can be as high as 80% of hairs being in telogen. And what you have to remember is that there will be no sign of any inflammation of any sort. So that is how the histology will look like, just as you can see in this picture here. As you can see in this picture here that I've put for you. So this is how the normal hair will look like. The hair in telogen, that's how it will look like. And it will be normal, no sign of any inflammation, no nothing. But when you do a count, most of the hairs, if you do like a cross section, most of the hairs will be in telogen phase. You know, in telogen, you usually see a bulb at the end, and then then a hair exiting this opening. So you see there's a bulb at the end here, and then this hair is up here exiting. So that's how you see on histology. So how do you manage? In this case, management is a little bit easy because you just need to identify the cause. If you identify the cause and stop it, the problem is gone. But in case someone has other systemic underlying diseases that are taking long to be managed, you can try to give drugs that can stimulate hair growth, including minoxidil, giving a 2 to 5%, depending on the sex. If it is female and you're using a lotion, you will give 2%. If it is a male and you're using a lotion, you can use 5%. But if it is foam, if the preparation is in foam, you can give 5% for male and female. And if someone has stress, you can now incorporate your treatment with a psychologist or a psychiatrist to try and address the emotional imbalance that someone has. Then after that, you need to follow up and monitor for the patterns of shedding and then the regrowth. And then in most of the time, the prognosis is excellent. If you remove the trigger, someone usually gets their hair within a few months and you're able to discharge them. So thank you very much. See you in the next session where we're talking about causes of hair loss.